Hello.
Hi, I'm Julia. I'm going to be your student nurse today. A provider just gave me an order to administer you a medication. I just wanted to come in here and ask you about what you knew about it and if you are comfortable taking it. So first, can I please get your name and date of birth?
Joanne Peterson, 1210XX.
And then can I look at your wristband to look over that? Thank you. Perfect. I'm going to wash my hands really quickly, and then I'm going to ask you about this drug that the provider told me to administer to you. So what do you know about metoprolol?
I take it at home, but I don't really know what it does.
Okay, so metoprolol is a medication that lowers your blood pressure. And right now you have a high blood pressure. It's 143/92, and a pretty healthy standard blood pressure is going to be 120/80. And it's not good for the rest of your body to be in this hypertensive state. So we want to take that blood pressure down, and this drug should do that for you. Do you have any questions about the drug itself before I go into the adverse effects?
No.
Okay. So something that we want to look out for is your heart rate lowering too low with this medication. And that could kind of show up as maybe you get a little dizzy, lightheaded, or in really extreme situations, you might become a little confused. And these are possible effects, but since you're in the hospital, we're going to make sure that we're monitoring your vitals and how you're feeling and make sure that you feel safe and comfortable while you're here. Do you have any questions about that?
No.
Okay, so while you're taking this drug, I just want to make sure that when you're standing up, sitting down, or going from lying down to a sitting up position, that you move slowly and carefully and are just like really aware of if you're starting to feel like pins and needles or lightheaded, because you are at risk for passing out if you stand up or sit down too fast.
Sounds good. I'll be careful about that.
Sweet. Do you have any other questions at all?
No.
Okay, so I want to make sure that you feel comfortable swallowing this medication because it is supposed to be administered orally. So have you ever swallowed a pill before?
Yep.
Okay, and do you feel comfortable doing that here today?
Mm-hmm.
And I want to make sure that you are not allergic to this medicine. So do you have any known drug allergies?
Nope.
Okay. Have you ever taken metoprolol in your past?
Yeah, I take it currently, but like I said, I wasn't too sure of what it did, but now
Okay.
I feel like I do.
Okay, perfect. Thank you. All right, then I think I'm gonna head out and go get that medication if you're ready for it.
Yeah.
Okay, sounds good. Okay, so then I wash my hands as I leave the room and provide for privacy, and then I go to the MAR and my lockbox filled with medication, and I do my 7 checks as I pull the medication out of the lockbox. So I make sure that it is metoprolol, which it is. I make sure that it's 50 milligram tablets, which it is. I make sure that it is a oral medication, which it is. I make sure that it's for the right person, which is Joanne Peterson. I make sure that it is for the right reason, which is high blood pressure. That's what this medication is for. And Joanne Peterson has a blood pressure of 143/92, which is high. And then I make sure that it's being administered at the right time, which is right now. So that is the right time. And then as I take it out of its container and put it on the tray that I'm bringing into the room, I do my med checks again. So I look and make sure that it is metoprolol and that it's 50 milligrams, that it is an oral medication, which it is, it's a tablet, that it's for the right person, Joanne Peterson, that's the right person, that it's for the right reason, which is high blood pressure. Joanne has a blood pressure of 143/92, which is a high blood pressure. And then I make sure that it's for the right time, which is right now. So that's right, and I document that I'm doing this, and then I'm going to go back into the room with my medication and water. So I'm gonna enter the room.
Hello.
Hi, Joanne. I provide for privacy and I wash my hands. As I go up to the patient, I'm going to do my 3rd medication check. So I'm going to make sure that it is the right medication. It's metoprolol, and that it's the right patient, which is Joanne Peterson. Can I please have you verify your name and date of birth for me?
Joanne Peterson, 1210XX.
Can I look at your wristband? Perfect, thank you. Then I make sure that it is administered at the right route, which is orally. This is a pill, perfect. Then I make sure that it is administered for the right reason, which is high blood pressure. That's the right reason. Then I make sure that it's administered in the right dose, and it's 50 milligrams. That's correct. And then I make sure that it's administered at the right time, which is right now. Do you feel comfortable swallowing this pill?
I do.
All right, then I'm gonna make sure you're in a comfortable position, sit you up. Do you feel like you're in a comfortable position, ready to swallow this pill?
Yep.
All right, here's your water, and here's your metoprolol. All right, now can you open up your mouth for me and make sure that it's all gone? Thank you. Okay, so right now, this medication is gonna take about 15 minutes to come into effect, and I'm gonna leave the room and I'm gonna go do a few other things, but I'll be back in 15 minutes to make sure that you're feeling all right, feeling like the medication's helping you out, not feeling dizzy or lightheaded. And then I'll be back to check on your vitals as well, just to make sure that your body's also feeling that way. All right, do you feel comfortable? Do you need anything else from me before you go?
Nope, I'm good.
Okay, do you want me to put your bed back down?
I'm feeling okay right now.
Okay, here's your call light. Let me know if anything changes. I wash my hands and provide for privacy as I leave the room. 15 minutes later. Hello. Hi, Joanne. How are you feeling?
I'm feeling great.
Sweet. Are you feeling lightheaded at all? Dizzy at all?
Nope.
Okay. Do you feel like it's helping?
Yeah, definitely.
Okay. I'm going to check your vitals really quick. They look great, so that's awesome. Great news. I just want to know if you have any other questions for me.
I think I'm okay.
Okay. Sounds good. Well, I'm gonna head out. I'll come back in around half an hour just to make sure you're still feeling good. But in the meantime, just let me know if you need anything and if I can help you with anything else.
Sounds good. We'll see you
Okay.
later.
I wash my hands and provide for privacy as I leave the room.